Hi, I'm Dr. Tracy Tyson. I'm a board certified general pediatrician, and I wanted to talk about a common question that I get, and that is fluoride safe for children, especially in our drinking water, and is it considered a neurotoxin? The word toxin is thrown around a lot on social media, and I can understand the concern and fear from families, so let's talk about it. A neurotoxin is a substance that can cause toxicity or damage to the brain at commonly occurring amounts. So right now in the United States, fluoride is not considered a neurotoxin because the amount that is added to our drinking water, combined with fluoride in children's toothpaste, combined with recommended dental treatments, is well below the recommended amount to be considered a neurotoxin. So why do we use it at all if there's the potential that it could be a neurotoxin? Well, remember, everything can be safe in appropriate amounts and unsafe at higher amounts. Oxygen at 21% is what we need in our air for us to maintain our lungs and brain activity. We could not survive at 28%. So 21% is safe, needed, necessary, helpful. 28% can actually be toxic. So the word toxin is thrown around a lot and it makes people scared, but I want you to remember that it is relative to the amount and to the age and size of the person. So here are the ways that your child might get exposed to fluoride and ways that it can help them, and then we can talk about ways that it could cause harm. In their community drinking water and in some wells also, there can be naturally occurring fluoride, and in community drinking water, it is added by a lot of cities and municipalities to increase fluoride in water available for children. We started using it in the 1960s in order to prevent dental decay because it helps create strength of the teeth so that the child and an adult is less likely to have cavities. Why do we care? We care because the teeth are the gateway to the overall health of the person. It has been shown to decrease their risk of cardiovascular disease, dementia, lots of other medical problems. And when we started really making teeth a priority worldwide, that's when we really noticed the biggest increase in lifespan in people. So it is really important and it is worth the risk, but we need to be smart about it. So the fluoride that is community drinking water is 0.7 milligrams per liter. The toxic amount is closer to 2. So we are well underneath that amount, and no city allows it to go over that. Some cities are even under that. Drinking wells typically don't have any fluoride, but they can have some naturally occurring fluoride in certain areas. So we do recommend people getting their wells tested to see how much fluoride is in your well water, and until you know that, don't allow your child to ingest it. Other ways that your child would get exposed to fluoride would be in fluoride-containing toothpaste, which is not started until the age of 18 months. So at 18 months, we recommend a rice or tiny amount of fluoride toothpaste on the toothbrush for brushing the teeth twice a day. There will be a tiny bit that is swallowed, but it is very, very small amounts, and I'll tell you how it adds up to the total when we get to the end. The third way is by dental treatment. So dentists put on a protective high dose amount of fluoride anywhere from 2 to 4 times a year, depending on the child's risk factors, in the office. It is a very safe and effective way to get extra protection for your teeth because very little is absorbed systemically, meaning it doesn't go into the body, so it can't go into the brain. So a very safe and effective way to get fluoride on your child's teeth if you're concerned about how much fluoride they're exposed to. So when you add up all the ways that children in the United States are exposed to fluoride based on our current guidelines, they are well under the threshold, and I'll put the numbers in the comments so you can see based on age what are those thresholds. They're well below the thresholds to cause any neurotoxicity, but above the thresholds to protect the teeth so that they don't have dental decay. This is extremely important. It's okay to be a little bit scared and confused because there's a lot of information out there, but this is highly regulated, very well studied, and more ongoing studies are happening so that we make sure that we are as up to date as possible. So talk to your dentist, talk to your primary care provider about your child's specific risk factors, how much fluoride they might be ingesting on a regular basis so that you can protect your child's teeth while also protecting their brain. I hope this helps. If you have any questions, let me know. I'll put some of the links to some of the studies as well as the amounts per day in the description so you can take a look at it. Take care.